Hey everyone, Bridget here at the AAFE Training Center. We are going to be doing some lifting threads on my patient this morning. So I'm going to start off by numbing the pilot sites where I'm going to be entering to place the threads. This patient has had multiple rounds of threads. She's probably had so many threads in her face over the years. So she always likes to kind of do these maybe like twice a year to kind of keep up with that collagen stimulation that starts to happen around the age of 25. So I do numb my pilot sites with Lido and Epi. The Epi just helps vasoconstrict so you don't have as much bleeding at the site. And then I go in with an 18 gauge pilot hole. I then take a 75 millimeter cannula and I'm numbing each track where the threads will be placed. I do combine a little bit of sodium bicarb in with my lidocaine to help any burning sensation. So I haven't had many patients complain after I started doing that. Usually the lidocaine is like the worst part of this procedure just because it burns so bad, and just kind of adding that little buffer really helps. So that's always what I like to do. And then I kind of, like I'm doing now, I'm making sure I'm at my appropriate depth, which is going to be that subdermal space. So a little bit deeper than what you would be placing like filler with a cannula with. And then I'm going in with my thread. So this day I used 18 by 100 millimeter Arte 1 threads by VSoft. These threads are made from polydeoxanone suture material. After a while, they tend to break down, and then they stimulate collagen in the place of the thread because your body senses that traumatic injury and just kind of goes to that space to fill it in. So you'll notice kind of an immediate lift, but usually about 3 to 6 months is going to be your peak lift. Each of these threads have little barbs on them, so that is what's physically lifting the tissue. VSoft also has these things called smooth threads, which are basically a really tiny version of the lifting threads, but they do not have the barbs on them. So those are just going to be stimulating collagen. The purpose of the lifting threads are to physically lift the tissue. So that's going to be your non-surgical facelift patients, any patients that have sagging tissue. This is really the only treatment if they are not interested in getting surgery, or if they're not getting surgery for, a few years. Then lifting threads kind of help prevent and also just kind of give them that buffer for the next few years until they're ready to get a surgical facelift. This patient, like I said, has been getting them for years and years, so she doesn't really have any jowl formation or anything in the lower face. She keeps up with her neurotoxin every 3 months, and we treat the lower face and her neck for that. So she really does keep up with procedures, and she looks really great. And like I said, this we were doing kind of before a big event that she had later in the month. So I always make sure to give myself a good 3 weeks with them having nothing important. So at least 3 weeks, only because the bruising and the swelling can be so bad compared to something like filler. So I always make sure, and if you want to be more cautious, you can definitely tell them a month. I tell my patients that they can't work out for 2 weeks, like no heavy weightlifting for 2 weeks. They can go on walks or like a light jog, like I'm okay with that, or Pilates or yoga, something light. But I don't want them, going to the gym and doing like heavy squats and putting so much pressure on their face, because these threads can break. That is a risk of the procedure. If that happens, it might kind of start poking out of the skin, which starts to look like a little whitehead or like a pimple almost. If that's the case, I usually tell them to apply heat to the area. It tends to break down the thread a little bit quicker than if, your patient wasn't heating the region. But like I said, it's pretty rare. If they're following post-care instructions, it really doesn't happen unless they do something to where it would put tension on the thread. And at the very end of the procedure, I make sure to smooth everything out, just because I don't want them to be puckered at all, which just means the barb is basically catching on part of the tissue that I, need to release. Thank you so much for watching.